So the first part of treatment for OCD is a really good assessment, which it sounds like it's not treatment, but I think one of the things I always say to young people with OCD is that you need to become your own expert. You need to really understand this in order to beat it. And people are very confused about why have they got these thoughts just popping into their brain, why have they got all these habits? And the idea that it's quite a neurobiological condition, I think needs some thought and an explanation, and actually can take quite a lot of the heat and the worry out of the problem. Once the diagnosis has been made, it's also about making sure that the people in the child's life, parents, siblings if necessary, sometimes teachers, other people, understand what's going on and the need for treatment. But there are two really effective treatments, and indeed there are NICE guidelines, there's government guidelines on the effective treatments. The treatment that we would suggest everybody is offered and should have access to is a talking treatment called cognitive behaviour therapy. There's been lots of increased awareness of CBT, as it's called, in the last few years. And basically CBT for obsessive compulsive disorder involves learning how to resist carrying out rituals a little bit at a time, so cutting back on it gradually, at the same time understanding that the anxiety that you experience isn't harmful or dreadful and can be tolerated. So it's like, again, with children, I often use the analogy, it's like being in training with a coach to practice being brave and to realise that you don't have to carry out routines. And then the thinking behind that can begin to change. There is also effective medication, which probably works as well immediately as the talking treatment does. So in 4 to 6 weeks, either medication or CBT will produce an effect. But one of the difficulties with medication, although it is very effective, is that if a person hasn't learnt CBT, when you stop medication, their symptoms usually come back. So if somebody wants to try medication, and for some people, particularly with severe OCD, it can be helpful, we would usually suggest it's combined with CBT. Cognitive behaviour therapy is a short treatment, and the normal package we offer at the Maudsley Children's Department is 14 sessions, which we try to give quite intensively, usually once a week, and fit 14 sessions in 17 weeks. But sometimes we offer it more intensively within 5 days, for example. People come for whole days. So it's usually, 14 to 20 hours of therapy. And it is very much an active treatment. It's teaching the young person skills that they then take away and practice at home. And we also involve parents very closely in learning the strategies. So if you like, they can be the home coach as well. So it's not a long treatment. Cognitive behaviour therapy is a very effective treatment for OCD and has been evaluated not just in clinical practice but in clinical trials. So it's been scientifically measured and tested and proven to be effective. And in the best possible studies, and of course CBT does vary in its quality, but with high quality CBT, probably 80% of young people will achieve a really good remission. They may not be 100% symptom free, but almost everybody will have a very good response to CBT. The young people who don't respond to cognitive behaviour therapy as the first treatment may be helped by adding medication in if they haven't had it already. Sometimes just further cognitive behaviour therapy, actually a longer course or a more intensive course, can be helpful. Young people who don't get better quickly and straightforwardly, it's always worth reassessing to see whether there's other factors. Are they very depressed as well? Sometimes OCD does go with other problems. Are they having difficulties at school or in their family or with learning? So it's always worth looking for other issues. Very occasionally, a young person with OCD can be so unwell that they need to come in to hospital. And again, we do have the capacity in the young people's services at the Maudsley to bring young people in under the adolescent team for a period of inpatient care if that's needed. So if a young person with OCD is admitted to hospital, the treatment they need is essentially still the same. So the treatments that work are serotonin enhancing medication, the SSRIs, and cognitive behaviour therapy. But being in on the ward just gives us the opportunity to monitor them much more closely and deliver those treatments more intensively with the help of the inpatient team. And often the young people who need to come in have been so unwell, they may have been out of school for several years, so they then have an opportunity to go to our unit school and to get their confidence back. They have an opportunity to mix with other young people and again regain some social confidence. So it's partly the environment of the inpatient unit which can support their recovery, and our team will go into the inpatient unit and work with them there.